Touch, taste, smell, hearing, and sight tell our brain what it needs to know about our world. But they may also be telling you something about your health. Our good friend and colleague, Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, is back, and she's going to help decode signals from our 5 senses. I want to ask you, what could a sudden change in hearing or sight mean?
So, one of the important things to know about sudden changes in hearing and sight is that it can either be the result of a stroke, or it can be the warning sign of a stroke. So you want to watch out for double vision, sudden or temporary vision loss in one or both eyes. And as for hearing, some people say that they can actually hear what's being said, but they can't understand what's being said.
And you may also experience numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking, loss of balance, and or severe headache with no obvious cause. A stroke can occur when the blood supply to your brain is interrupted. Here's what's important. If you think you or someone else may be having a stroke, immediately dial 911. Stroke may also affect smell and taste, but if your taste and smell are affected, what else might this mean?
Changes in smell and taste can also be the result of a concussion or another form of traumatic head injury. This is really interesting. The nerve that carries the sensation of smell from your nose to your brain actually runs through your brain. So it's at really high risk for injury if you have a head trauma. And of course, if your smell is affected, then your taste is affected too.
So true, and certainly with a head injury, call your doctor right away if you experience headache, nausea, vomiting, dizziness, confusion, sleep disruption, or changes in your mood and behavior. And finally, what does our sense of touch tell us about our health?
So we actually think of touch as an important signal for a particular disorder called neuropathy, which is often caused by diabetes. Excess blood sugar can damage the capillaries that carry blood to the nerves in your hands and feet. So it's kind of this chain effect. And when that happens, those nerves may stop sending signals back to the brain. That affects the sensation of touch. And some people experience this as prickling, tingling sensation, but other people experience this as sharp, jabbing, throbbing pain, or pain that is burning or freezing in nature. Or some people complain of extremely sensitive feet.
If you experience these symptoms, speak to your healthcare provider who can test to see if you might have diabetes or potentially some other disease. If you do have diabetes, your doctor should do a complete check of your feet once a year and a quick check at every visit. Your doctor will talk with you about the right kind of shoe you can wear and teach you how to inspect your feet regularly for cuts or blisters because of their high risk for infection. And Dr. Freda, all of this is so very important.
It is important. And so you can go to gethealthystayhealthy.com for more information on how knowing about your 5 senses can keep you on top of your health. And of course, while you're there, you can sign up for our monthly newsletter.
Thank you as always. Really appreciate it.